Hey, welcome everybody to Ask Our Vet, brought to you by Rockwell Pets Pro. I'm Mike, the Voice Monkey, your host. As always, with me is Dr. Max. You may not see Dr. Max, but you'll see him as soon as he starts talking right about now.
Hey everyone. Good evening, everyone.
I think that's working. Hold on, let me just do that. That's fine. We can do that. We'll do that for now. We'll see. We'll see how it goes. She may yell at me. How are things going, Dr. Max? How are things going on your end?
Everything's good over here, Mike. Can't complain. Beautiful day, cold day here in New York. But yeah, a bunch of sick dogs and cats came through, some cute puppies, kittens. Yeah, things are exciting, bumping, hopping with the village vet. So it was an exciting day.
You didn't get any snow up there today, did you?
Thank God, no. It did. We did have some bad rain yesterday, but thankfully my bike ride to and from work did not involve any precipitation, but a bunch of wind, which persisted till today.
It's hard to ride a bike in the wind. I get that. It's tough.
Yeah.
So anyway, cute dogs and puppies this week. Anything interesting you want to share with everybody?
Yeah, we definitely saw some cute dogs and puppies. I didn't do so much picture taking, but I, definitely have some memorable patients. Today there was a really cute chocolate lab with, either pancreatitis or HGE, hemorrhagic gastroenteritis. I don't exactly know, but excuse me. We're treating her, and she's steadily improving on fluids. Yeah, just a bunch of bloody diarrhea. It was just crazy because she was a same day appointment and drop off early in the morning, and I had my appointments throughout the day, and I was just periodically we would let her out to go outside if she needed to go number one or number two, and she went on a couple walks, and I was discharging a cat to this guy. He was a really nice owner, and off walked our chocolate lab down the sidewalk with my technician Anne, and all of a sudden just like explosive bloody diarrhea. But the wind, it was just, as I mentioned, so windy today. It just came over and wafted toward us. We were like 20 or 30 feet away, and it was very evident. So that was kind of a suboptimal discharge. We laughed about it, the cat owner and I. But that's been going on. And what else? Yeah, just a bunch of old cats, hyperthyroid cats, chronic kidney disease cats. Yeah, that was one of the trends today.
So tell me a little bit about the clinic up there that you work in. You're in the city.
Yeah.
So you're in Manhattan. Do you have a place to walk the dogs? Is it, hey, I'm a suburb kind of guy, so I'm not much of the big city. I've been to New York a few times, but the lack of parking really bothers me in New York. But it's, down here, every store has a giant parking lot in front of it. So up there, where space is at a premium, are you guys in the first floor of a building? How does it work up there?
It's a great question. We're in an apartment building. We are on the first floor only, and then I think it's a 5 or 6 story building, and the rest of the stories are apartments, some of which are rented by owners of our patients. So it's nice. Funny when
convenient.
There's like this King Charles Cavalier that we see walk by every day, and it's like not only is it our patient, but it's our building partner. So that's on the first floor. There's no parking lot. It's storefront, and there's like a parking. There actually technically is a parking garage on our street. I don't know of any clients of ours who drive in their own vehicles and park on the street or in the parking lot. Some people, I would say the vast majority of people who come in are from the neighborhood.
Hmm.
or used to live here, and they like the culture, they have a rapport with us, and so even if they move to Brooklyn, for example, they may schlep all the way over here, like take the subway. Um, Usually that would be the case, but I would say the vast majority are local neighborhood residents, and they walk over, or carry dogs over, or cats,
Hmm.
um, and then some people Uber, get dropped off. Um, I think that's the vast majority.
So you could take your pets on the subway?
You can. Cats are cool. Dogs, there's a rule that you have to keep them in a bag. And people have come up with all these like funny things. They just like a Great Dane, they just like create a huge bag and stick the legs through, and that counts, I guess. I don't know why, like that's
That is
the thing.
like a big garbage bag. You just,
Something like that. People
slap
are
it on your dog.
creative.
And then, yeah,
People are creative, yeah.
that's New York.
Yeah.
So, you have any good food around your place there? You guys like to go
We
lunch?
do, we do. So usually, our Thursday night talks, our little podcast here. I
Hmm.
think we've mentioned in the post show that my wife and I usually get in Indian food after
Hmm.
our little talk. It's a nice kosher Indian restaurant. I'll do a shameless plug. I'm not paid to do this, but Ahimsa on East 10th. It's a great spot. Um, and I'm sure there's a pizza spot down our street. That seems like it gets a lot of traffic, and it's everything in New York. It's
Sure.
yeah.
Are there any good Jewish delis around there? I love me a
Um,
good Jewish deli. I mean, not
yeah,
even
for
even
sure,
like a
for sure.
bad Jewish deli, but there's still
In fact,
there's something about the pastrami or the corned beef and the rye, and it's
yeah,
so good.
it's true. It's true. I haven't been to it, but I've heard that Second Ave Deli is good. I think there's a place called Mendy's in Midtown. Our area isn't the most. I think Upper East Side might be the good spot, and like uh, as you can see, I'm not a New York like local through and through because I
Yeah,
only moved here less than a year ago.
that's
But
right.
Upper East Side, and then there's another spot, maybe Washington Heights, I think that has a lot of like Jewish areas and stores and restaurants. There is a good. It's not the traditional Jewish deli because they don't really have meat there, but a place called Bagel Boss that's in my
Oh,
neighborhood, and I'll
yeah,
usually like grab tuna bagel, and in between my shifts and on a lunch break.
yeah,
Um,
that's right.
yeah,
Get a bagel, get a little schmear, you're good to go. Yeah.
little schmear, little
Oh
tuna, little
yeah.
pickle. Yeah.
We've got a place down here that's I don't go there anymore because they're not very nice. But they do like New York bagels. Like they
Hmm.
boil them and then cook whatever, bake them and stuff like that, and they're really good. But they've had some issues with their health inspections over the years, and they were rude about it, and it's not worth my time. But the bagels, when I had them, they were really good. They were
Yeah.
genuine New York bagels, so it was nice. I guess they had the New York attitude to go with
Yeah.
it. I wanted
Well,
to
you know
let
what?
it. Go ahead.
Oh, sorry.
No, I just want to let
What?
everybody know if they want to ask questions, then put them in the chat and we'll answer them as we go. We're talking about joint health tonight. But yes, Dr. Max, go ahead. Bagels.
Yeah.
The
I mean,
important thing,
a-
bagels.
ask about right. Ask about bagels. Ask about. Well, we'll jump into nutrition for sure. That's important for joint
That's
health.
right.
But I remember what I was going to say. Oh, there's a funny YouTube channel that I'm not subscribed to, but I see the recommendations come on my feed a lot because I was introduced to it like back in vet school. I think someone told me about it. It's called the Chicken Connoisseur, and it's
Okay.
this kid. He's like, I think maybe started in the middle school. Now he's in high school. Uh, this kid in London who basically just like he started off just making them for fun. And now I think he's endorsed by Nike. But essentially he goes from chicken joint to chicken joint in London and just ranks them by the fries and the chicken and the wings and the burgers. And he gives them a score each. So my recommendation to you is you can give a pretty bad review to the place that has the, bad inspection ratings and, bad uh, the boss man, the
Mm-hmm.
manager isn't so nice, and that's part of the rating system. So
Oh yeah, yeah. I used to
I
write
think,
for a blog down here that we did. I did restaurant reviews, so I'd go and meet with the people and get their story and eat their food
yeah,
and write nice things about them. So it was good. Did a nice job for
yeah,
a while.
that's cool. It's funny, like, when it comes to, we'll do a casual slide into the joint health swing of things tonight, but in reviewing, I know hip dysplasia is on the agenda
Mm,
for tonight and everything, but just general joint health, there's so many products on the market, and there is so little oversight and regulation, from the FDA of a lot of these products. And so I have owners come to me from the breeder, and it's some vitamin, unlabeled packaging, plastic
right.
bag, Ziploc, whatever, and then like a little
Oh
thing
boy.
smacked on there. You really don't know what you're getting when it comes to that. So I always like tell owners, like, this could be fine, this could be good. I don't think it's going to be the most important thing, or the only thing, or maybe even should be a thing in as part of your dog's like total nutritional package, or your puppy, growth stage. Um, but yeah, I mean, I wouldn't be able to, like, as a vet, endorse any specific product, or, say, these are the ratings that I should do. But there are definitely companies that I'm, happy to discuss later on, that, we trust their products, we trust the research, and they're healthy and safe to use for your dog. And I think that's what a lot of owners, I feel, come to me with questions, because they just don't know. And like, if I don't know, how can we expect them to know?
Right.
And I think, as part of the puppy package, when, we bring home our new baby, there's all these things, just like a human, not just like a human child, but there's so much that, no parent is ready to parent. And I feel like the same goes with puppy parents. And so there's just a lot of discussion to be had. And if it would be helpful, I can kind of talk to you about what I generally tell pet owners and stuff like that.
Yeah, absolutely. And I don't know if I'd really give my dog something from a Ziploc bag that it's Uncle John's special mix of joint health supplements. That's, maybe it's a
I,
joint health supplement, maybe it's cocaine, maybe it's baking soda. Who knows? Don't give
who
it to
really
your
knows?
dog if it comes in
Yeah,
you buy it at the lady at the craft fair who makes her own joint supplements. And that's a very unregulated industry. A lot of vitamins and things like that, where you
true.
have people we had people all the time. We'd recommend fish oil, things like that. And I don't know, you don't really know how much your dog is absorbing of these vitamins to help. And especially if it's something random and unlabeled and possibly illegal, you definitely don't want to.
Yeah.
My dog seems like he's high. Well, he was sniffing that bag earlier. So yeah, you don't go through the airport with Uncle John's
Right.
special joint supplement. So we're so tonight we're going to be talking about joint health.
Cocaine.
Specifically, get off that. Specifically, hip dysplasia. Hip dysplasia is a pretty big issue with dogs. I know you see it. I see it all the time. Back when I worked orthopedics, it was hip hip surgeries, hip pain, hip problems, hip this, hip. Um, with joint disease, joint stiffness, is it mainly older dogs that get that, or can it start at any age?
It definitely can start in puppies for sure. I guess who's most likely to be affected? I would say the large breed dogs, the giant breeds.
Mm-hmm.
Those are the most commonly affected. The poster child uh, dog that I think of who would be symptomatic for hip dysplasia. I think of a obese, not moving around so much, not getting so much exercise, chocolate lab or yellow lab. I think of yellow labs. I don't know why,
Labs,
but
yeah.
that's what I
Mm-hmm.
think of. Labs. So
Goldens.
yeah, Labs, Goldens, German Shepherds, Great Danes, Saint Bernards, Old English Sheepdogs. My in-laws actually just got an old English sheepdog puppy, Warren, who's adorable, and thank God, knock on wood, doing fine orthopedically as of right now. But yeah, those big breed dogs, Neapolitan Mastiffs, Bulldogs, those are the affected players primarily.
And certainly being fat doesn't help. At any breed.
Sure.
Any breed. Anything you're adding so much more weight on those joints, it's going to tear them up. So if anybody has any questions, put them in the chat. We'll answer them. So definitely fat dogs, not a good thing. Keep them skinny. With that, do you at what age do you normally talk to owners about hip dysplasia, or do you wait until there's a problem, or do you preemptively have a discussion with them?
I definitely, I'm more of a, and I guess to answer the initial question that you had about like, when it can be seen, mention the breeds, it can be seen later in life, especially when osteoarthritis starts to kick in. But it can be seen and be, the early, more subtle signs of a dog with symptomatic hip dysplasia can be seen earlier in life, in a puppy, 4 or 5 months old. But I guess when do I talk to owners about this? I don't bring up the word hip dysplasia usually in a first-time puppy visit. But I do talk to them about, the relative importance of exercise, weight gain. I'm expecting a puppy, a large breed dog, to, every 3 to 4 weeks, when they come in for their vaccines, while the vaccines themselves are extremely important, I feel like one of the most important things is to not only just get them up to the vaccines, but assess where they're at in their growth, and the weight. It's a very simple tool that we have, a scale, but it's an important metric because, I saw a cat with hyperthyroidism today, and he is extremely, I really don't like this cat, not to be rude. And the owner knows that we don't like this cat. She understands that he's completely different in the clinic versus in her home. But, and I bet that's the case too. Maybe he's a love bug at home. I believe it. But he's just notorious. Everyone knows his name. And he's kind of evil in the clinic. And we saw him. Yeah, we saw him for, he's 16 years old man. His hyperthyroidism has been managed on it for years. And he had like his, we assess every kind of 3 to 6 months, make sure that, we do need to increase or decrease the dosage. And his dose, his total thyroid hormone level is historically been great. This year, or this particular month rather, it's, which I think was actually the first time it was measured this year, was just 0.1 micrograms above the normal reference of the upper limit of normal, for a cat with hyperthyroidism. And, I told the owner, like, technically, yes, we can increase his dosage. But, that would be the purest way. That would definitely be the academic, the right thing to do. But in lieu of him not really showing signs of uncontrolled hyperthyroidism, weight loss, ravenous eating, just muscle wasting away, do we need to do that? And can we get away with like the lowest effective dose? And so I, mentioned that to her. And the big thing is that he actually has gained weight from last visit. He was like 8 pounds. I was 9.25 pounds, which is fantastic. I'm sure you've seen a bunch of hyperthyroid cats over the course of, working at vets. And
I had one. Yeah.
And you had one. Yeah. And he or she probably was like skin and bones.
Oh yeah.
And, sometimes it's like 4 or 5 pounds. I mean, it's crazy. But this guy's gained weight. So I'm very pleased with that. And, at the end of the day, it's, you treat the patient, not necessarily the numbers on the the blood work. So that's what I told her. I told her, we're going to do it in 3 months again. If it goes up more, sure, we can do that. But for me, the big thing, the takeaway is the fact that he's gained weight and looking a little bit better. So with that in mind, when I see young Mastiff puppy, and he's supposed to gain weight, that's what they do, and it's such exciting, fast growth phase in their life. But he's little chubs. I really have to kind of. I'm not chastising the owner, but I definitely tell them, like, listen, it's good that he's gained weight, but it's not good that he's gained this much weight. And these are the reasons why. And this is what we want to prevent. It's good that he's not showing any symptoms now, but we need to kind of modulate the amount of calories that you're giving. And then so, I talk to them, they tell me the specific diet that he or she's on. We go on the back of the nutrition label and, see how many calories per cup or, whatever diet it is, and kind of dose reduce. But I think, I have the conversations early. I don't necessarily specifically say the words hip dysplasia at the first puppy visit, because I do want to have the owners leave with like a sense of not dread. I think it's important that the first time, especially like I would say on the daily, I have at least one or maybe even up to 4 new pet owners, like first time pet owners.
Wow.
It really is like a puppy pandemic. And a lot of them,
like gun sales now. There's so many first time gun owners out there. They're out there buying guns and dogs. So yeah.
It's real talk, especially after what's going on this whole week and the Derek Chauvin trial and, just the state of affairs and everything, Indiana. God bless everyone, mankind, for the unfortunate things that have happened. But it's true, it's very easy, I guess, to buy a dog and a gun these days. And, we have to treat them well. We have to treat our dogs well. And a lot of people just have no clue. But I don't want them to leave that first appointment saying, oh my God, my King Charles Cavalier is going to develop degenerative mitral valve disease.
That's right.
Yeah,
her eyes are going to pop out. She's going to
get going to pop out, exophthalmos.
Yeah.
Or, I think those things in my head. Yeah. I think, I saw a cute dachshund this morning. Oh, going to get IVDD. Give it a few years. If she gains enough weight. Mrs. Zombie was her name. Cute little dachshund. She could get IVDD. So I don't say that, but I'm like, we look forward to seeing you back in 3 or 4 weeks. These are the things that, we'll be looking out for. We expect you to be gaining weight, but we want to, make sure that you don't overload with the treats or something. Obviously, That's a good way to enhance the human-animal bond, but it's a very easy way to pack on the pounds too.
That's right. Food is not love.
Food is not love.
Like you said, there's nothing happier than watching your puppy just go to town on a bowl of food, but you're doing that 17 times a day. Imagine you doing that, going to the buffet all the time, and you're going to pack on the pounds, and you're going to have arthritis, and you're going to have hip dysplasia. So what causes hip dysplasia?
So it's your genes. That's essentially what it boils down to. I saw the cool little question on a little questionnaire thing for this podcast about, can't find it now. The powers that be. Sent a lot of questions this time. I can't find the question, but it was essentially like I got this dog, both the mother and father were negative for hip dysplasia. Can my dog get it? And the answer is yes, for sure. They may both carry like the recessive allele, and maybe they're not expressing it physically. Their phenotype is not manifesting in them, but passing it down, unfortunately, baby Great Dane inherits both those alleles from the parent, recessive, and then is susceptible and will develop dysplasia. So that's kind of what it boils down to, the parents. That being said, if a dog does get it, and by it, the dysplastic portion is essentially that the ball and socket joint of the hip. So you have the femur and the pelvis, the acetabulum, which is kind of like the socket ball goes into. If there's uneven growth of one versus the other, they are not growing at equal rates, then potentially when a dog moves, the head of that head of the femur is going to subluxate and kind of move out. It's like it has joint laxity and movement, and so it will kind of, instead of be square in there, it's kind of going to the side a little bit, and instead of being deep in like the acetabular rim, that kind of like what's it called? Not a satellite, an observatory. You think of those like big space observatories that like with that big indentation in the ground. And I was thinking about it because one of my friends is going to Puerto Rico in 2 weeks, and the largest radio telescope in the world was Arecibo, and it got destroyed. Sadly,
it fell apart. Yeah, it
fell apart, which is so sad.
It fell into disrepair, and then they were talking about like, well, maybe we should tear it down, and then it fell apart. Like a big part of it collapsed, and it was in the movie GoldenEye. They used that, the James Bond movie.
Oh, I actually didn't know that.
The end of that was filmed at that telescope. Yeah,
interesting.
Or radioscope or whatever it is.
Well, I'll have to check out that scene. My then fiance and I actually went. That was our last trip before COVID. We went to Puerto Rico, and nice. I told her, I learned about this in my Spanish class in high school. Why don't we check it out while we're in Puerto Rico? So we drove to Arecibo, went there, took the tour. It was awesome. And it's just crazy to think that it's no longer operational, and it's kind of crazy. But it was a beautiful, beautiful spot. But yeah, so like essentially that crater holds the head of the femur, and a dog that's maybe running around, it can, or has hip dysplasia, will potentially have a portion of that head kind of subluxate out, and you might even hear a pop. And owners sometimes will do that, freaks them out, and it may not necessarily cause pain immediately to a pet, but that looseness, that laxity is definitely not a good thing, and it can cause some microfractures in part of the pelvis and lead to bad news later on. But that being said, a dog who has hip dysplasia, and I don't know like the statistics, what percentage are going to develop lameness or difficulty getting up, or irritation, swelling of the joint, swelling of the limb, versus those who are relatively asymptomatic. But it's something that, even though genes are a huge part of it, it's like nature and nurture. And so, as we mentioned, being overweight, being a dog who isn't active, those are big contributing factors. And another thing is like, some of my owners say, oh no, he gets like a bunch of exercise. We go on hikes on the weekend, every weekend. But if during the regular day, like work week, he's not moving at all, that's actually a bad thing. So I do stress to owners that while it's great to run around on the weekend and stuff and get that aerobic exercise, it's really important to do it, I would say, like at least an hour a day. And maybe the owner won't hit that hour, but I tell them an hour so they can at least strive for it. But we and our animals and our dogs are meant to move. That's what we do.
Right. Yeah.
And I think consistent daily exercise is important. And a dog who, an overweight Labrador who's not, getting any exercise during the week, but then, on Saturday morning, plays 3 hours at the park, that actually might be a recipe for disaster.
Yeah.
Because
like a weekend warrior.
And then all of a sudden they're not used to moving the joint so much, and then they pull a cruciate, or they do have hip dysplasia, and it really does start to manifest after those weekend warrior outings. So it's, we can't. Oh, sorry, were you gonna
say? No, go ahead.
Yeah, I mean, we can't necessarily prevent hip dysplasia. You can't, but you can do a lot of things to offset the onset of symptoms, or potentially prevent them from happening in a dog's life.
How do you test for hip dysplasia, and how old does a dog have to be before you can start monitoring for hip dysplasia?
So you test with radiography, taking x-rays of the hip, and I think one of the best projections would be the ventrodorsal, the VD view, and that will kind of show you the hips and kind of how much coverage they have in that acetabulum. And there's like this thing called Pen Hip, or the Orthopedic Foundation of America, or something, and you can send they're really like sticklers for like the exact views. You probably did a lot more of that than I did, but
we did. We had a lot of breeders come in, and I think don't quote me, but I think it's about 6 months old. You can take or 2 years. I can't remember how old it was, but it's you come in, and they'd want the VD pelvis. And they were so particular about how everything is and the alignment and yeah. So majority of the time, it's easier just to sedate the dog, because they're relaxed. They're not fighting you. They're not, whatever. We had a V-tray. Basically, it was just, I think we stole it.
The trough thing?
The trough. We stole it from ultrasound, because it's big. It's like dark purple. And it's got foam inside of it. And we plop the dog down in there, and it's able to align them really well. And we had digital x-rays, so we could take, look, no, adjust, take. Even now, it was my job to hold the, take the legs and turn them in, and you had to get the patella right over the knee, and the legs had to be straight. They couldn't be, in or out or anything like that. And we did the pin hip and stuff, and had it, and we, printed them out, or not print them out, but save them to a disc and send them off to whoever that certifies hips, because people who are breeding dogs, they want to know, does my dog have hip dysplasia, or it's going to have hip dysplasia? So that was kind of a feather in their cap to go, no, my dog's hips are awesome. And we do the same thing with elbows. We do hips and elbows. We x-ray the elbow, for any kind of possible elbow dysplasia, or, a fragmented coronoid process or anything like that. We'd have to get them on the table, and we'd have to flex that elbow beyond probably where the dog was happy. So again, sedation works. But we had it down. They would, so-and-so's coming in for hips and elbows. It's like, oh, all right. And, we'd knock the dog out and get it done. So it was
reverse.
Bigger dogs are tough, man. Bigger dogs, they got the big legs. I think that's the only reason they kept me around the clinic. Because I may not have been the greatest technician, but I could definitely twist those legs in there, and I was definitely stronger than anybody in the place. But it's tough for those guys. So I've got on here, I was reading some of the questions that they sent us. Is how much exercise is too much exercise for these guys? I know if you want to do about an hour a day, if there's a dog and he is just going full tilt all the time, is that also a bad thing for these guys in terms of like arthritis or joint health?
Yeah, I mean, I guess it really depends on the individual, on the breed, predisposition. Like certain dogs are not built to do 4 or 5 mile hikes. Like I'm not expecting a Great Dane to do that. Yeah, I mean, I think it really depends on the patient and its clinical history. For a dog that has hip dysplasia and is overweight and I guess it depends on the age too, but I would have I would put more emphasis actually on, trying to get the weight down before, ramping up. I mean, it's hard. There's no like right answer here. But especially when sometimes there is such a thing as too much exercise for sure.
Mm-hmm.
And I just, I tell owners what I think is probably best based on their dog's specific needs and body condition and age. And, with the assumption, with this older dog and with or without x-rays having been taken or not, if there's osteophyte development and osteoarthritis that's kind of started, those dogs probably are going to be in a lot of pain after long bouts of exercise. So it really depends.
What are some of the signs that your dog may have some OA or osteoarthritis or hip dysplasia? What should owners look out for?
Yeah, I mean, owners should be looking out for difficulty getting up from a laying or seated position. They should be looking for lameness, and that could be of one limb or multiple limbs. Or it could be like a shifting leg lameness is kind of a classic sign. So it's like, oh, it was the right one, but oh wait, maybe I still think it was the left. So that's kind of like one of the things that you listen for in a history. So those are ones, vocalizing if you touch a specific joint or, you bump into them or something and they're not really liking that. Maybe even growling or trying to bite because it hurts. It could be joint swelling. Those are big ones to look for. Fever, sometimes inappetence, lethargy. These are kind of non-specific signs, but you start, thinking based on the dog's signalment and age, body condition, as start ruling out some things.
What are some of the best ways to treat joint issues and or hip dysplasia?
I think some of the best ways are non-steroidal anti-inflammatory drugs, your Rimidils, your Galliprants.
Mm-hmm.
I use those a lot for prevention and continued treatment for dogs who have established arthritis or dysplasia. Joint supplements, and there's the brands that I am familiar with, I'm comfortable with, will often recommend would be like Dasequin, Cosequin, Glycoflex, Vicox. There's I'm just looking at a list right now, but those are the ones that I've used in the past. And there's a bunch of other ones with like trademarks. But yeah, so glucosamine chondroitin supplements are what I just labeled, just mentioned. But yeah, I mean, I would say that. And then, not giving your dog high calorie, high fat treats, looking at the diet, maybe considering a therapeutic diet that has some glucosamine chondroitin in it. Hill's JD is a good one. Like healthy treats if you're accustomed to, and that's, you know, what your dog likes, that has antioxidants, blueberries, turmeric for anti-inflammatory properties. Yeah, I mean, just like stuff like that. Those are ways that I would say. You know, those would be like the non-invasive, you know, medical supplement, medical route of helping things out.
So is surgery ever an option? Let's talk about some invasive treatments for hip dysplasia.
Yeah, it is. It's something that, I'll be honest, I've never actually done myself. You know, we save that for the orthopedic surgeons, and I would love to hear about, you know, if you could speak to, you know, your history of being involved in some of like the FHOs, total hip replacements, TPOs. There's all sorts of like different procedures that can be done based on how young, like usually like for puppies is when I would say a lot of these are good for, and it'll also depend on the dog's weight, and if it's like a large breed dog and, you know, has, you know, good 50-60 pounds, that's kind of riding on that joint, because really like the weight bearing axis is such a fragile thing. Like, you know, sometimes if I do something to like graze my toe and I just like kind of hurt a little part of the nail or something, it actually like makes a big difference on how I walk.
Right.
And it's like, this shouldn't be like, this really shouldn't be. But there's, you know, a good amount of weight right down on that side of the body. And it really, you know, I feel like whenever something bad happens to me, like my, you know, cat bite cellulitis, which, check it out, it looks awesome.
Yeah.
A little bit of a scar, but like,
yeah,
fully functional.
You're a vet, you have to have scars. So yeah,
you gotta have scars. Yeah, from bears or cats. But essentially, like it makes you really appreciate, you know, how delicate the system is. And so, yeah, I've never done a surgery. I have recommended certain patients who kind of fit the criteria, and are young enough and maybe lean and not heavy enough to undergo these procedures. And yeah, this is kind of where I leave it to you, because I kind of just, you know, refer to the orthopedic surgeon for those cases. What has your experience been with those?
We did a lot of you know, FHOs, the femoral head osteectomies, where you just basically just remove the femoral head. You know that. I'm just letting everybody know. And that seems to work pretty well. Depends on the size of the dog. We've done it on little dogs and big dogs. The TPO, the triple pelvic osteotomy, it's mostly younger dogs. I think we did those on. I scrubbed in on a few of those. There's not much for me to do, you know, retract this, retract that, but they had special plates made for those little stepped plates that you could put on, and the dogs did pretty well. But we've seen hips to the point to where the poor femoral head is just flat, and the acetabulum it's just like this, basically. You know, it's supposed to be like this, and then this is spread out, and that's just flattened out. And you feel for these guys, because you know it hurts. And and dogs, especially the ones that you said get this more often, the labs and the Goldens, and, you know, nothing's going to stop these dogs. They don't care. They don't care how much pain they got to get to the food bowl. They got to get to your, you know, they want to go chase the ball. They want to do whatever. And when they're having a hard time going up and down the stairs, or they're, you know, it's time to get up, and it's like, they, you know, they're just trying so hard. You feel terrible for them. But yeah, we've done a bit of surgery on those, but when it gets to the point where it's so gone that, you know, you can do an FHO at that point and just take off what's left. And you get the bone on bone, and it's no fun for
Yeah.
those guys. Um, would you recommend animal rehab for some of these guys, or swimming?
Yeah, that's for sure something that, yeah, sorry that, we're only mentioning just now, but those are actually really, really good things. I think that can't be understated. I worked at one practice in Boston that did have hydrotherapy, so the underwater treadmill, and that's
Mm-hmm.
awesome. I think, that's just such a great thing. Definitely helped me when I had my orthopedic woes, my ACL surgery. Um, you know, a little bit after the surgery, when kind of the scar tissue, you can't just go immediately after. Um, but for sure, I mean, I think with or without surgery, that's a really good thing to kind of help with, muscle mass, and kind of taking the weight off of a dog. And so kind of a couple times a week having some sort of, if that's an option in your area. I think it may be a little limited, but for sure, hydrotherapy, massage, stretching at home. There's
Mm-hmm.
a lot of, like, I'm sure, YouTube videos of kind of showing owners kind of how you can do that. I think it's a great way also to just bond with your pet. You may offer some comfort, and you kind of get to know their body a little bit better. Might feel a little bit awkward at first, but I think, those are really good alternative modalities for therapy.
Yeah, I think the rehabs are popping up more and more. It's becoming a little
I
bit.
think,
It was kind of like,
yeah.
but now it's the place I used to work. We had a rehab facility in house,
Hmm.
that shared a space with us. There was a separate business, kind of under the same umbrella. But if you go to an orthopedic or a specialist, if they hopefully will have a relationship with a place like that they can send you to. My
Yeah.
dog had the underwater treadmill, is amazing. If you guys want to look up on YouTube, just underwater treadmill for dogs, and they can raise and lower the water level to increase to decrease weight bearing. I've
Yeah.
seen cats doing it. It's crazy with the cats in the tank. Cold laser therapy, those kind of things were good for joints and tendons. And my dog's got a little bit of a tarsal issue, so it's good cold laser on that. And she
Hmm.
loves it. She's a golden, so she likes the water, and she goes right in the tank and just goes to town. I've seen where they smear peanut butter on the door of the tank, so the dog has something to look
The
at and
target to
something
go to.
to encourage it, because sometimes they'll just stop and they just go to the back of the tank and smack the back wall. It keeps them actually moving and motivated to keep
Yeah.
moving. So in terms of we talked a lot about hip problems, and that's certainly, I think, the most common. In terms of elbows or the wrist, or the carpus or the tarsus, anything like that, in terms of arthritis on those joints, what are some treatments that you could do for those other things that maybe aren't as popular as the hips?
Aren't as popular as hips. I mean, I think a lot of what we mentioned is also very applicable. In terms of NSAID therapy. I guess it really depends. Like, one of the other things that we didn't really touch on here would be the degree that trauma plays in degenerative joint disease, and whether it's a one-time thing. My friend Brooke's dog, Duke, beautiful little dog. I have no idea. Like, we have no idea. It's a Maltese, poodle, Cavapoo, something. He's
Hmm.
he's adorable. She got him, and the very next day, he actually jumped off the couch and broke his radius and ulna.
Mm-hmm.
And thank God had surgery. Doing fine after. It's been like a year or something since then. But that is, and luckily it was like mid shaft, not at the growth plates or affecting any carpi or carpal bones or anything. Um, but things like that, or jumping out, if a dog jumps out of a car, or dog, keeps landing on a specific part of, especially in the forelimb, or the elbow, as you mentioned, the fractured medial coronoid process, or there's like the ununited anconial process that young German Shepherds can get. There's all sorts of things that can, get bumped into, or, jump wrong or land wrong. And that kind of little micro trauma events, stack up. And in time, you do an x-ray, and it's not the hip joint, obviously, so you're not seeing any dysplasia, but you are seeing some little new bony growth, and maybe a microfracture. And that could be something that is hurting a joint in the forelimb, as you mentioned. And so I think the very same applies depending on the degree of the fracture. Is it comminuted? Is it clean? Do we need to surgically fix this, splint it, rest, NSAIDs, joint supplements, long term. Those are all very real things. And then, like you mentioned, the cold laser, photobiomodulation. There's all sorts of new things these days, but those are big ones to consider.
I think it is worth noting that anytime you mess with a joint surgically, or there's trauma, there's going to be arthritis. Your body's gonna, people would come in with a cruciate tear, and it's like, oh, but my dog's got arthritis now.
Yeah.
It's like, yeah, because you're going in and you're messing with stuff, and the body, that it gets inflamed. The body doesn't like that, which forms your arthritis.
Inflammation of the joint, arthritis.
Yeah. A couple of things that we used to do, especially in elbows, we'd have dogs with either dysplasia or OA or something. We would do either steroid intra-joint steroid injections, hyaluronic acid,
I'm losing you a little bit. I heard hyaluronic acid, but then I missed out on anything else.
Okay.
Hello? Hello?
Can you hear me?
I heard you say, can you hear me now?
About stem cell, like that.
I'm really sorry. I don't hear you at all now.
It's fine. It's fine. Probably.
Hello, everyone. I think that I'm the only one on the show right now. If you have any questions, please feel free to leave them in the chat. Happy to answer. Hopefully we'll get Mike back in shortly. It's been a pleasure talking to him. Mike the voice monkey. I'm going to dip out for a second, but hopefully we'll be back live in a few minutes.
Oh.
Are you back? Hello?
Is that better?
Say something again. I'm really sorry. I don't actually hear you. I want to hear you, but I don't.
How is that?
Oh, that's really good. That's good.
Okay. So what about like stem cells?
Yeah. I have not personally done that, but I know that wow, this is taking me back to what rotation was I on? Back to vet school. I do remember that we did some of those intra-articular injections. Wow, I'm forgetting right now that off the top of my head the specific acronym, but I do recall one of the radiologists performing that injection. It'll come to me as soon as we're off this
I'm sure.
air.
Yeah.
But yeah, that would be something to consider.
Cool. Well, I think we need to wrap this up before the before it craps out again. So, any kind of parting words you want to leave everybody about hip dysplasia, arthritis, joint health?
Yeah, what would I leave owners with? Sometimes when you see it. Like I was biking through Central Park yesterday. I saw a guy walking a German Shepherd, and you know how some of them, they just like their back end is like that.
Mm-hmm.
It's like stereotypic. It doesn't always have to look that bad to be hip dysplasia, but if you do have a large breed dog or any breed dog, really, who may be overweight and maybe a young puppy or not, but is having hind limb trouble, bring him to your vet, and he or she will be able to discuss with you, options for diagnostics and treatment. And X-rays can be expensive, like totally understandable. That's one of the kind of hindrances that I think I run into a lot, where you may not want to kind of do that, and it's understandable, but there is a lot of value and utility in making a diagnosis, even early on. And it's not like a death sentence that this is something that your dog will have to live with these symptoms related to hip dysplasia for the rest of his life. We can make a diagnosis potentially fairly easily, and then work with you to develop steps on how to go about treating it, or preventing onset of really bad problems.
Excellent. Well, before we go, I wanted to let people know they can get $10 off natural dog vitamins if you go to rockwellpetspro.com and enter the code senior before they check out. Well, Dr. Max, it's been a fun week talking about hip dysplasia. We will be back next week at 7 p.m. on the same Facebook and YouTube. And who knows what we're going to talk about next week? We will find out probably next Wednesday. Have a good night. Have a good night there, Dr. Max.
You take care, Mike. Bye.